Hello friends, once again as I promised, I'm making this small presentation to discuss that how the concepts of Vipassana meditation be useful on clinical population. So as a mental health professional, I usually deal with people who are having various psychological conditions which are emotionally driven or various mental disorders which are emotionally driven in nature. So I think Vipassana concepts can be useful for conditions like migraine, for headaches, in which patients are having a sensation which is painful, obviously, which is throbbing, or which is pulsating or piercing type of sensation, and patient usually get very much, impaired in their daily living. So I think patient can be told to practice, and patient can be, patient remold their way of seeing this particular sensation as it is a sensation. It is not a my sensation. So patient actually visualize this sensation and not it is my sensation. So in that way I think it can be effective in migraine and this tension headaches conditions, be it localized pain or it is generalized pain. Second, I think it can be useful for those conditions where patient is having a particular distress thought or thought, and all the presentations are revolving around this particular thought. Like for example, conditions like obsessive compulsive disorder, conditions like anxiety neurosis or GADs, conditions like panic disorders, where the patient's hallmark feature is a particular thought and a particular emotion which is associated with the particular thought, maybe of distress, fear, of anxiety, etc. So patient can be told to witness this thought, and this is second, and I think first could be patient can be told to accept this thought, this thing, that they are actually having a particular thought. So I am having a particular thought, fine. Second, simply accept this thing, that this is a thought and there is no need to react to it. It is like concepts of neutrality. So acceptance and neutrality will go side by side. Acceptance will be the first part of this intervention, and become neutral or be neutral will be the second part. I think this can be tried on, and I think all these third generation of psychotherapies like mindfulness based cognitive interventions or acceptance commitment therapies, etc., they have in a way, they are influenced by this Vipassana meditation, because they are actually using the concepts of mindfulness, like being in the moment, like awareness, and the concepts of acceptance. So I think this can be tried. Third thing, I think this concept can be tried on somatization, because as we all understand, somatization and all forms of psychosomatic conditions, they are always have their underlying cause at the unconscious level. Mostly they are, not mostly, almost or always they are psychogenic in origin. So when things are psychogenic in origin, it is lying at the unconscious part of your mind. And as we understand this Vipassana meditation, we can mold our conscious part of mind by manipulations, by learning, etc. But we cannot mold our unconscious part of mind by just learning or just reading books or etc. So by Vipassana meditation, when we see the sensory process and we are not actually reacting to this process, howsoever pleasant it is, howsoever unpleasant it is, we are in a way becoming neutral. So in that way, whatever somatic presentation is there on our body will definitely vanish away. So if somebody practices Vipassana meditation, I think the somatic presentations or the psychosomatic presentations or the somatization complaints will definitely go, because after all they are just the overt manifestation of the underlying conflicts, underlying unfulfilled wishes, underlying desires. So I think this whole spectrum of somatization or whole spectrum of psychosomatic disorders has its treatment in Vipassana meditation. So Vipassana meditation or inputs can be useful for these thought driven conditions, for sensation driven condition, and for those conditions which are having their base at the unconscious part of mind, because our unconscious part of mind actually and always is related to our body. Conscious part is free, so you are aware of your conscious part, and you can manipulate your conscious part, but unconscious part remains always attached with your body. So whenever there is unfulfilled wish, it represents itself in the form of sensation on our body. So when this bodily sensation and you are becoming neutral to it, so this sensation will, this need will go. So when at a time will arrive when all needs will go, then I think the somatic complaints of presentation, definitely they will also vanish. So I think this way these concepts can be clinically tried or clinically used, can be useful for different variety of stress related or neurotic spectrum conditions. So I think I will try to practice or learn more and try to use on my clinical patients. Let's see how it can be simplified, or it can be make it we can make it more practically driven, so that it can be implemented in a very simpler form or simpler way across population. So the idea of making this small presentation or the video is that so I will not forget what I have learned in this 10 days, and it will not mix with my previously accumulated learning. So now I will recall what I have recorded here, so that I will try to strive on these ideas. Second, the idea is also to share my views, my experiences with other people, so that other people may also benefit, and if they wish, they can also undergo Vipassana meditation training, and they can be benefited from this. And I think at this point I should end this video now. And if you have any suggestions or comments or advice, please don't hesitate to write me on my mail, so that I can improve on it. And if you disagree with me, it's fine, it's no problem. It's a personal experience, so please comment that also, so that it can be discussed further on my on my coming videos. Or definitely I will try to travel across, and my whole passion now is to travel and to accumulate wisdom on various things, or various perspectives across cult, or across religion, across philosophies or spiritual things. First I will try to travel across India, and definitely I will some point try to go abroad also, especially Burma, and let's see how it goes off. I'm not in a mood to accumulate things which are materialistic in nature. I'm in a mood to accumulate more of wisdom. Well, that is my point of view, and in a flow I just said all these things, because I'm openly discussing things with my small audience. So I think now I should go, because it's a long time and it's very sunny now, and yeah, it's tiring. I got tired also. 10 days of very low diet, which we are not used to, and 10 days of 12 hours of meditation per day. Now I will go for a small walk peacefully, and then went to my hometown. I hope this small sharing of views, or exchange of views should I say, will be helpful for all those who are viewing this. So please do write me if you want, and do share your advice with me, and definitely I will make another videos of my new experiences wherever I travel. And if you switch on the notification icon in your subscription on my YouTube channel, then definitely you will come to know whenever new videos will be uploaded. And for my previous videos, you can go on to my YouTube channel. So finally, I will say, as they say in Vipassana meditation, may all beings be liberated and be happy. And this experience for me is a newer one as compared to the previous two experiences. So I will try to relish and cherish this experience in my day-to-day life. Let's see how it goes. Finally, this is Dr. Lakshmi signing off for now. Take care. Bye.